Let me go stand up. Yeah. Do we have a list?
No, 5 minutes.
So at the present moment, nobody is actually signed up to provide public input. So if you signed up on the wrong sheet,
No pressure.
Just came to listen.
but this
You
is
should be
the
on
sheet
this
to
side of the
sign up
table.
to do public testimony, not the sign-in sheet. Just wanted to make sure everyone was clear.
Good morning.
Hold the button. Yeah. You got it.
No, I'm colorblind.
The red green doesn't work.
Good morning. Welcome to this listening session to gain public input and feedback on the proposed changes to the Commission's Accountable Care Organization Certification Program. I think as many of you know, under Mass General Law, the HPC is required to establish a process for certain registered provider organizations to be certified as accountable care organizations. The purpose of ACO certification is to complement existing state national care transformation efforts that validate value-based care delivery and investments in high quality and cost-efficient care. In 2017, the Commission issued its first set of certification standards. Those standards coincided with the rollout of the Mass Health ACO program. And to date, we have 18 ACOs that have achieved certification under the 2017 standards. This listening session will focus on proposed updates to those standards, as well as a new voluntary distinction program that seeks to recognize those ACOs that achieve further performance in key areas such as cost, quality, and health equity. These will be described by staff in more detail this morning. We know my fellow commissioners and staff of the HPC greatly value public comment and feedback on so many dimensions of our work. This listening session is another example of our desire to ensure that our work is grounded in the knowledge and experience by those working to provide care and those who receive care through our healthcare system. With that, I'm going to turn it over to Catherine Harrison, our ACO certification guru, who will describe the current set of standards as well as what is being asked for or proposed, and hopefully that will stimulate some of you to have comments and that we can listen to in this listening session.
Thank you, Commissioner Cohen. Thanks for that new title. Appreciate that. The ACO certification program is one way in which the HPC advances our vision for a transformed care delivery system. And that vision is really focused on patients being at the center, with providers and payers being held accountable for high-value care and integration across medical, behavioral, and health-related social needs. So ACO certification is meant, first and foremost, to advance that vision. Another core value of our program is that it encouraged the integration of care through collaborations between the healthcare system and non-medical community providers. We also want our certification program itself to be a learning program, improving over time, just as we hope that our healthcare organizations are doing so as well. And finally, we seek to balance the interests of continuing to expand public knowledge and transparency about ACOs and grow the evidence base with an awareness of the burden that falls on providers in completing the certification requirements. So these are our guiding principles and ideals. And it's important to remember that ACO certification is an important tool, but it's not the only tool that the HPC has to support our vision for a transformed care delivery system. We engage with stakeholders and support this kind of transformation through our investment programs, through technical assistance, through convening multi-stakeholder groups to explore solutions to various healthcare problems, raising the profile of key issues through our learning and dissemination work and other means. So ACO certification is one lever, but our vision is supported by a lot of work around that. As many of you well know, there are multiple ACO programs in the market today, from the Medicare ACO initiatives to long-standing and newer commercial programs to the Mass Health ACO program, which, as you know, just launched in 2018. And evidence on the relationship between ACO capabilities and processes and outcomes is still developing. So in these initial few years of ACO certification, which, as the Commissioner Cohen said, was only first launched in 2017, our focus really is establishing a set of standards that are applicable across different payer types, and this is important. Our program looks at core capabilities that an ACO should have across its patient population, regardless of the payer. And as I've alluded to already, we're also focused on building knowledge and increasing transparency and enabling learning in the system. And we're looking to make sure, of course, that our program is broadly consistent with other state programs and initiatives and other requirements that touch on care delivery improvement. We've also said from the outset of this program that our longer-term vision is that we move away from a process-based certification approach and instead evaluate ACOs for certification based on their actual cost and quality performance. And I think you'll see that evolution as we talk about our proposal for 2019. So I'll go through very briefly what we are proposing to do in 2019. In keeping with the vision that I've just described, we're proposing some updates to the set of certification requirements for 2019. And this proposal would apply to ACOs that are seeking to either renew or achieve certification for the first time in either 2019 or 2020. In particular, we're proposing an application format and sections similar to those used in 2017 with a few modifications. So the first section is a background information section that would capture some basic information about ACOs as an organization and the risk contracts they hold. The assessment criteria section would include 5 standards and documentation requirements for each. And a section for supplemental questions would include questions divided into a couple of categories. And I'll get into all of this in a little bit more detail. Of course, I'll refer you to the full written document that we have issued for public comment for details. My purpose this morning is not to go into all of that detail, but just to give a little bit of an overview so we all on the same page as we listen to public comment. We're also proposing to create a new voluntary distinction program for certified ACOs that would recognize ACOs that have achieved performance improvements in the domains of the AAA. So, for a quick overview, for the background information section, the main categories of data that we're proposing to collect include some summary information on the ACO organization, which would include a brief description of its history of mission, the regions in which it operates, and an organizational chart. Information on the ACO participants, particularly primary care providers and participating hospitals that participate under various risk contracts. I'll note it's important to say that to the extent that this information is already captured by the HPC through our Registration of Provider Organizations program, we would leverage that data source rather than requiring ACOs to submit a duplicate. Finally, information on risk contracts in which the ACO participates, including some of the key parameters of those arrangements and actual performance information. So that's the background information section in a nutshell. For the assessment criteria section, as in 2017, the HPC is proposing that ACOs be required to meet particular standards in each of the areas listed on this slide. So this is not just about capturing information. This is about the HPC having established a standard in these domains and looking for evidence that ACOs meet those standards. And again, I'll refer you to the written document for full details here, but I'll just give some examples. For example, under the governance structure domain, we would set a requirement that ACOs have to demonstrate that participating providers comprise 75% of the membership of the governing body of the organization. Under the performance improvement standard, we'd be looking for evidence that quality performance is reviewed regularly and that goals for improvement are established and communicated throughout the organization. On the whole, the HPC is proposing to keep these assessment criteria largely unchanged from the 2017 program. As such, applicants for certification would have the opportunity either to update their 2017 responses or to attest to the HPC that their previous response still remains fully accurate and applicable for 2019. For the 2019 Supplemental Questions section, the HPC is proposing including two types of questions that address distinct but complementary goals. The first type of questions, which is what we're calling adding to the evidence base, would be aimed at addressing adding to or filling gaps that are identified in the current evidence base. So the topics for questions in this section might include things like how ACO organizations distribute shared savings or otherwise incentivize providers through performance-based compensation models, approaches to providing high-value care, and particularly care delivered in high-value settings, the integration of behavioral health into primary care, and the use of advanced information technology to enable care coordination. The second category of questions we're calling emerging topics, and here our goal is to find out more about really innovative approaches that ACOs may be using to address emerging areas of focus. And these might include new care models or ways of delivering care, telemedicine, paramedicine, medication for addiction treatment, and the like. Also innovations around addressing the social determinants of health, and new uses of workforce or new roles in the workforce that are being deployed, such as recovery coaches and community health workers. Again, on the whole, like 2017, the supplemental questions section is meant to gather information. Our goal here is not to set a particular standard that ACOs would be required to meet, although every applicant for certification would be required to fully answer all of these questions. The HPC would not be evaluating those responses other than for completeness. So that's our proposal for the core of ACO certification for 2019. To talk now just a little bit about our proposal for a new distinction program. As I mentioned, this would be layered on top of the sort of base certification. So this is a new program that would seek to recognize ACOs that have achieved improvements in the domains of the triple aim. So that's healthcare outcomes, improvements in care, and reduced cost, plus showing progress in addressing health equity, and that commit to continuing to improve in those areas through strategic plans. We're proposing to grant distinction for a 2 or 3 year term and to base it on two components: demonstrated improvement on selected measures. So as we say in the public comment document, we would anticipate that the HPC would select some measures and use ACO reported data to assess the improvement of the ACO, and strategic plans for continued improvement. So for example, we would have ACOs describe a goal for the coming 2 or 3 years, how they plan to continue improvement in a given area, and use that as another aspect of determining the basis for granting distinction. Again, more details on our thinking are provided in public comment. I will say that our thinking about this aspect of our program is in early stages, and we would be expecting to use really the balance of 2019 to fully think through and design and build out this program. So our thinking is that we would be aiming to launch the distinction aspect sometime in early 2020. Slower time frame than the other proposal that we're talking about today. So speaking of timeline, just quickly, some near-term milestones to be mindful of. Written public comments are due to the HPC on February 8th, After that, we plan to move fairly rapidly to review and consider all of those written comments, make any revisions to our proposal, and then meet with our Care Delivery Transformation Committee, of which Commissioner Cohen is the chair, in a public session on February 27th to make a final recommendation on our 2019 program. Thereafter, we would aim to finalize all the details of the application, including the specific documentation requirements, and build out the technical infrastructure, the system for accepting this information through the spring, and planning to open up the application for everyone to begin applying by late summer, early fall. So that's it.
Thanks,
Oh,
Kathy.
I didn't need to show the slide, sorry about that.
Oh.
Timeline.
Great. Before I open it up, let me just go over some of the technical aspects. So the listening session is being live streamed on the HPC YouTube channel. All attendees are welcome to offer testimony either in person or through written comments. There is a sign-in sheet, as was pointed out earlier, for those wishing to testify today. I would ask that if you are planning to testify, that you focus your testimony on the proposed standards. Also, we are limiting comments to 5 minutes. Any remarks made by groups of no more than 4 will be limited to 10 minutes. Written comments will be accepted, as Catherine mentioned, through February 8th at 5 p.m. All written and oral comments submitted to the HPC will be posted on the HPC's website and released in response to a request for public records. And I guess we're at the point where we can open it up for public comment, feedback, any ideas, input, as was from the information presented or what has been provided in the larger document.
We don't have anyone formally signed up at this point in time. Also, I will say happy to take questions if anyone has questions on the material that Catherine just presented or on our process.
And I would also add for folks interested, if you're new to the ACO developments, there also on the website are some couple policy briefs that describe the current state of ACOs in Massachusetts with a focus on the aspects of those that have been certified thus far. So draw your attention to those. Yes.
Have there been any incentives that have been discussed about the distinction program or possible incentives?
A shiny seal.
Yeah.
Sure. I think we're open to all ideas at this stage. The distinction program is, still really in early stages of development. And I think, I'll let Katie give any comments. I think from my perspective, I would say I would love to hear if there are ideas out there about what would look like effective incentives to ACOs to seek distinction.
I just wanted to add that as a reference point, the statute, section chapter 60 of chapter 224, does contemplate this model ACO program and thinking about an incentive program through public payer levers. So Mass Health, the Group Insurance Commission, the Connector. We have already started talking with Mass Health about their interest in a distinction program and what some incentives around that would be very early in those discussions. But just would say that, that is contemplated in the statute and we would hope to engage those intergovernmental partners first, and then obviously engage the private market as well. And thinking about a utility for this program in a number of different ways. I can think of it in terms of consumer transparency, showing consumers which primary care providers are associated with higher performing ACOs, product design, limited networks, tiered networks, and then lastly, of course, kind of contracting relationships, which is what Mass Health has a requirement for the base standards that you have to meet those in order to participate in their contract. No, nothing certain yet, but certainly on the radar.
Thank you. Good area for further exploration. Anyone else? because we really want to hear from folks. So I would encourage you, as you leave and think about this work, certainly get us any written comments that you might have that would be important. Did you have them?
Yeah, actually, good morning, everybody. My name is Monique Bertiva from Cambridge Healthlines. I actually did have a question to follow up on the distinction. It's clear that it's voluntary for this year. Is there any thought for future years if this moves forward to making it mandatory?
Great question.
That one. Hi Monique, how are you? I think the point of a distinction program is to always have it be a distinction program, that higher performing ACOs who want to seek it can seek it. I think making it mandatory undermines the point of it, but and I do think, I will look to my legal colleagues, the idea of a model distinction program really in the statute is intended to be voluntary.
Anyone else?
Actually, now that I have the floor, why not take it? The other thing I just wanted to underscore, when Catherine, you were talking about how much you're going to be looking at all the other ways in which we provide information to the state, like through the RPO, I would just underscore that we're all administrative burden is a big concern to all other providers. So any way in which you could take information from our previous submissions, include that for us to verify rather than create something from scratch would be greatly appreciated.
Yeah, I think that's something we've been conscious of all along, so I appreciate that. Anyone else?
Esther Kim Partners, ACO. I think, Catherine, to your point around the supplemental questions, about that is really collecting information. I think one of the things that we noticed, the questions are all phrases, how does your ACO perform such and such? And if you're really collecting information, that feels a little bit leading, and it should be more about does, or thinking about reframing that question to really, gather information. I know like one specific question around the number of staff for coding, that's really broad, but also very specific. So I'd like you to consider thinking through how better to collect more open-ended questions, because I know the options are also maybe multiple choice and maybe yes or no, and just having that be more open, maybe give you more information that you need to see.
Great point.
Thank you, I appreciate that. And one of the things that we sometimes struggle with, or from our 2017 experience, is providing kind of an open-ended response is sometimes a great way, to your point, to give lots of room for ACOs to tell us various approaches or sort of frame their response in a way that makes sense to them. The downside to that, of course, is comparability. So one of our goals with the supplemental questions is to try to, I think, strike that right balance and ask some things that make it a little bit easier for us to analyze the similarities and differences across ACOs. But I understand where you're coming from in terms of thinking about really carefully framing those questions, both to get information that's useful to us, but also relevant and kind of meets you where you are. We'll think that through.
Anyone else? All right, again, any written comments by 5 p.m. February 8th? I would certainly encourage folks to give some thought to what you heard today or what you've seen in the documents, and then get us your comments. But thank you all.